Public health physicians in Nigeria are expected to converge in Lagos, southwest Nigeria, for their association's scientific conference scheduled for Tuesday and Wednesday with the theme Pandemics and Emergency Preparedness Beyond COVID-19. The conference will feature discussions on leadership in health crisis, vaccine and public health, and mental health, among others. Current and past Lagos State Commissioners for Health, Professor Akin Abayomi and Dr. Jide Idris, will be joining other experts to discuss different areas of public health management. And now in the studio with us is Dr. Alero Robert, a public health physician, to look at the forthcoming scientific conference. It's good to have you join us on the program.
Thank you very much for having me.
So let's start with this program that we have. It's scheduled for next week, isn't it? Tuesday, Wednesday. Tell us a little bit more about it. What will be discussed? What are the expectations? What would be the possible outcome from this conference?
Well, this is a particularly exciting conference because this is the first time we're doing a 2-day hybrid conference where we're having a day one and a day two and incorporating actual scientific papers that will be debated upon and discussed and their relevance to the public health space as we go forward. I've been a past conference chair. We hold this every 2 years to bring public health physicians together so that we better understand the terrain in which we're working, the people whom we're working with and whom we're working for. So this year we have found that with the collaboration we've had with the State Ministry of Health, this thing has really exploded into yet another and higher level of conference, and we're really excited about what's coming up.
Indeed. Now, the theme of your conference, Pandemics and Emergency Preparedness Beyond COVID-19, how appropriate is this, knowing the pandemic is yet to abate?
Well, the truth of the matter is when COVID did hit, one of the things that quickly became evident were that there were huge gaps in the health system that really had only been papered over, and really the depth of it hadn't been addressed. So one of the things that was keenly obvious, this was pretty much global, but once the global supply chain went down, we were left with nothing. And the truth of the matter is people very quickly realized that there's hardly anything in the health system that we manufacture locally. And so when we're talking about emergency preparedness, what we are really tired of as public health physicians is this lastminute.com throwing money at a problem, expecting that if you throw enough money at it, something will stick. No. When public health works perfectly, you shouldn't even know that we are around. That's when it's working perfectly. The minute we come into prominence is because things that ought to have been done haven't been done. So the emergency preparedness and the pandemics we're talking about, whether we like it or not, there's something else coming. There is something else coming. We've been talking climate change. We have been talking climate change for decades. Not in Glasgow last week. Yeah. Mm-hmm. We've been talking climate change for decades, and with climate change, you're always going to see new and emerging diseases come forth. You're going to see a resurgence of old diseases that we thought we had dealt with come up. Are we ready? And we don't want a situation where when it comes, then we'll now start looking for what we need to do. When we're talking about, do we have enough human resources for health? Let's start there. And that is a 10-year, 20-year program of lead planning, right from primary school, to start training the appropriate healthcare workers that we need, health services, health resources for health, and not just in the medicine, the nursing, that's what everybody thinks of. Engineers, biomedical engineers, manufacturers. These are all areas that are going to impact the health space going forward, and we need to continue strengthening our preparedness.
Now, given what you've just said, do you find that you get a lot of support from the state government or from the federal government in terms of bringing to fruition some of the ideas that you just mentioned?
You like putting me in trouble on this program. You really do. State government, we've gotten an immense amount of support. It's been absolutely fantastic. He is the incident commander, and he has led from the front, from the back, and on both sides. It's been amazing. I suppose it does help that his wife is a doctor, but we shan't go there. Federal government, there are a lot more layers of bureaucracy, and therefore it makes it a bit more difficult to pinpoint whether we're getting support or whether they're just doing what they normally do. And that makes it, so I really can't comment too much on that. But one of the things that we are seeing is that people are I mean, that level of transparency and accountability and having to meet up to international global standards is now becoming a thing that is more often spoken about, and people are realizing that it's very important to have everything in place up to an agreed global standard for things to work.
You see, the reason why I ask, is from one of the things that you said, which is the last minute thing that everyone does at the last minute, So if you're not getting the support, or if you're not getting full support, then it's going to be like a catch-22 situation where if we are faced with a dilemma, then we're not going to be properly equipped to be able to deal with any kind of problem.
I hear you, but I guess then the word we're talking about isn't support. The word we're talking about is system strengthening. Now, in the public health space, you have to realize
that is support in some kind of way.
In a way, but don't forget there's a lot of intersectoral collaboration to get a certain public health standard. Do you have a water supply? Do you have sanitation? Do you have good engineering? Do you have safe housing? Do you have security? Do you have primary, secondary, and tertiary education? You understand what I'm saying? So, and these are all areas outside of health per se. So, when we're talking support, we need to do this for us, as a country, as a people, as a nation, as a community, as a society, for your family. We need to do this for us. So even you sitting here, one of the things that we've been we are not just because I'm sitting in your studio, but we've been very, very honored and pleased about, is this media collaboration, this media partnership that we've had. I mean, over the COVID just made it absolutely fantastic. Getting experts and looking for and getting experts in virology, in public health, in systems engineering, in everything to come and answer some of these cogent questions. So let's talk about data. Data is a statistician, is a systems engineer, is working tablets and ITs and things like that. We even have to strengthen that. Because until we have the data, how many babies are being born? How many primary school places will we need? How many of them are good in science? How many of them are good in art? How many of them will do the humanities? How many?
All
Numbers.
Right. Let's just focus a little about the science of this scenario. Decades back, you had vaccinations for measles and other infectious diseases which lasted for years in your body, as it were. But today we talk about 2 jabs and the need for booster shots. So what is the major difference here, and why is it so difficult to contain this one?
Well, this is a new area. This is a new vaccine. So immunologically, what is happening? This is a new disease, and we haven't yet fully understood the body's immunological reaction to the disease and to the vaccine. So I can't even pretend to be an immunologist, so I won't even go there. But what we are finding is that even people who have had 2 vaccinations are still getting sick. So definitely over time, the scientists are going to produce a vaccine that is more, that is more specific to the COVID virus. However, don't forget, this is a virus that is mutating, as all the flu viruses do. So even when you get one this year that is specific to this virus, a couple of mutations later, you do need to upgrade that. So that is what is going on. I do think that this is one of those situations where we're going to be having annual flu jabs like they do in the Western Hemisphere.
So would you say to a large extent it's a new norm?
Definitely is a new norm. It most definitely is a new norm.
And just before we go, I'd like to know, in your own assessment, how soon can life go back to normal?
Define normal.
In your own definition, I would imagine.
This is normal. Going everywhere with a mask on your face is normal.
Yeah, but when you say normal, for how long would that be? Are you saying permanently, till eternity, till...
Until
so how
the
long?
Next big thing hits. And
right. So you don't see us going back to...
We are definitely not going back to pre-pandemic Nigeria. We're definitely not going back to pre-pandemic society. We're not going back to pre-pandemic socials. We're not going back to pre-pandemic anything.
And not just in Nigeria, you're talking globally.
Globally and locally.
All right, on that note, Dr. Alero Roberts, a public health physician, would like to thank you for enlightening us just before your conference, which is taking place sometime next week. It's good to have you with us on the program.
Thank you very much for having me.